Nichols here, and today we're starting our second video in our pathology series about Krabbe's disease. So Krabbe's disease was discovered by Krabbe. He was a Dutch neurologist in the early 1900s. So what is Krabbe's disease? Krabbe's disease is an autosomal recessive disorder, and it is caused by a deficiency in that lysosomal activity. So this is the enzyme GALC, and because it's deficient, you have a galactosylceramide accumulation, and this causes for your myelins to be degraded. So what's the incidence like with Krabbe's disease? Krabbe's disease occurs about 1 in every 100,000 births in the United States. So there are 4 subtypes of Krabbe's disease. So the infantile subtype, which is the most common, occurs between the ages of 3 and 6 months years old. And this makes up about 85 to 90% of cases that are seen. Type 2, which is the late infantile, occurs between 6 months and 3 years. And type 3, which is considered the juvenile subtype, it occurs between 3 and 8 years. And type 4, which is the adult subtype, occurs anything after 8 years. So because these subtype ages are so low, the average life expectancy for Krabbe's disease is about 7 years. So how does Krabbe's disease present? So unlike other diseases, Krabbe's disease doesn't have any physical abnormalities or any cardiac defects. So how these patients present is usually like irritability, hypertonia, and hyperatresia, which is their skin is getting is overly sensitive, like to the touch. And however, like one of the cardinal signs which physicians look for is optic atrophy, where the patient's eyes, actually their ocular lenses, they start to deteriorate. So how does Krabbe's disease work in terms of its biochemical pathway? So you have the GALC enzyme, which is deficient. So this enzyme is actually called galactocerebrosidase. So when you have this enzyme deficiency, you have substrates that accumulate, and these substrates are galactocerebroside and cytosine. So when you have these substrates accumulating, this interrupts your axon myelin sheaths. So when those are damaged or deficient, in this case, patients they lose their motor functions, which is one of the symptoms of Krabbe's disease. So how do you test for Krabbe's disease? So there are 2 ways. You can either do a blood test or a CSF analysis. So with the blood test, the physicians are looking for your enzyme activity levels in your blood, and what they're looking for is if your enzyme activity levels are low. Now with the CSF analysis, what they're looking for is if you have abnormal protein levels in your CSF. So how do you treat Krabbe's disease? Unfortunately, there's no cure for Krabbe's disease. However, you are able to treat the underlying symptoms to a certain extent to maybe give the patients a better quality of life. So some of these treatments include supportive care, stem cell transplants, bone marrow transplants, as well as chemotherapy. However, with stem cell transplants, it's only been proven effective for patients who have yet to show symptoms within the first 2 earlier stages of Krabbe's disease. However, with bone marrow transplants and chemotherapy, both of those therapies have been shown mixed results and have yet to be proven 100% effective. Hi guys, thank you for watching our Krabbe's disease video in our High Yield Pathology series. Don't forget to hit like and subscribe, and stay tuned for our next video. Thanks. Bye now.